on diet and lifestyle, what works and what doesn't.
Thank you, Dr. Krishnadas. So, my job is to tell about lifestyle management, diet and lifestyle management, what works and what does not work. So, uh, let us first begin with a goal. What is our goal in lifestyle management? Is it the weight loss? Is weight loss is the goal? So if we advise weight loss as the goal, so once the weight loss is achieved, then our job is over. Should we stop? We say that you have achieved the weight loss and you are now good to go. But what happens once the weight loss is achieved? After some time, with whatever measures the weight loss is achieved, be it diet, lifestyle or drugs, and if he goes back to the same lifestyle, he again gets back to the same weight. Most of the time, in most of the studies which have shown that as long as the diet and lifestyle has continued, the weight comes down, but the significant problem of regain of weight is there. So the correct goal should be achieving and maintaining a healthy lifestyle and not just weight loss. So a person, the first question we should ask the patient is, have you achieved a healthy lifestyle? And if that is achieved, then weight loss would be a secondary product which will be achieved, and subsequently he would improve his health outcomes, and also he would have metabolic benefits like hepatic, musculoskeletal, cardiovascular, and he will have a healthy old age. So the first key point I would like to emphasize, the goal should be maintaining a healthy lifestyle and not merely weight loss. And during the follow-up, once the patient comes to you for a follow-up, instead of asking the patient how much weight he has lost, it's better to ask whether he has incorporated healthy habits into his lifestyle, spend time with the patient, understand his lifestyle and barriers to a good dietary and habits and lifestyle, and educate him with the healthy habits according to his capabilities and resources, and just do not rely on dietitian. So you'll have to spend time with the patient. That is the first. Second, what about calorie counting? So when we are advising some patients to reduce weight, how important is calorie counting? So this was a meta-analysis which was done few years ago, and it compared various behavioral techniques which are beneficial for weight loss. And among these, calorie counting remains one of the most important. It was even more than even contact with dietitians. So studies have shown that those who are able to do calorie counting achieve a greater weight loss. And now from 2022 onwards, even the Indian government has mandated that even the menu of the restaurant should contain the calories as well, along with the price of that food items. So what are the pros and cons of calorie counting? Although there are lots of pros that you have a better weight management, but the patient loses focus on the food composition, and sometimes it may lead to a kind of obsession. So should you count calories or not? So my take on this would be, whether you meticulously count calories or not, but at least we should be aware of the calorie content of the food, and teach your patient as well as yourself how to be aware of the calorie content of the food. So there are lots of good apps. For example, this is MyFitnessPal app or Healthify Me app. So all of you are carrying smartphones, so you can download one of these apps which can help you at least gauge what are the calorie content of most of the food. So once you become aware of the calorie content, then you will know about what are the foods which are calorie dense and what foods are not calorie dense. For example, all these foods which I have displayed here, all of them are 100 calories. But with the first one, which is just about jelly beans, you will not feel full once you eat, although you have consumed 100 calories. But with this plate of full tomatoes, you'll feel full. So if you are aware of the calorie contents and which foods are calorie dense and which foods are not calorie dense, then you will be better equipped with the weight control. So learn which are the energy dense food. And don't stay hungry. Substitute high energy dense food with the low energy dense food. For example, this food which contains steak and some vegetables is 800 calories. Suppose you reduce half of all this, it becomes 400 calories, but you'll feel still feel hungry even after eating this. But if you again replace it with lots of vegetables, then at least you'll feel feel full, as well as your calories content will be less. And also start reading the labels. This simple classic Lay's chips, even 15 chips in this contains 160 calories, which is much higher. So take home points regarding calorie counting, make the patient aware of the concept of calorie counting, and I'm assuring you that most of the patients are not even aware of the calories. So calculate whether the patient is consuming more calories than which is required. So you can employ a dietitian who can do a 24-hour dietary recall, and then encourage the patient to use one of these apps, and then patient can then themselves choose which are the less energy dense food. But after calorie counting, is it enough? No. There are other things which are also important. So the type of food also matters. So there are foods which have high glycemic index, and there are food which have low glycemic index food. So high glycemic index food will rapidly increase your insulin level once you eat these food. It will lead to increased surge in insulin, and then suddenly the blood glucose level will come down, and you'll feel hunger pangs, and then this vicious cycle will go on, and you'll eventually eat more. And if you eat low glycemic index food, then you'll feel full for a longer time, and you'll eventually eat less. So you have to reset your eating habits. So you have to give your patients a list of foods which are of high glycemic index and of low glycemic index, and let the patient choose himself. You have to advise that from all the foods which you have to choose wisely. So instead of giving a diet chart, specific diet chart that you eat this thing at morning, this in afternoon, you give him a choice of food. So encourage your patient to swap high glycemic index food from his diet to low glycemic index food. For example, instead of white bread, he can switch over to brown bread. Instead of white rice, to brown rice. Instead of maida, to multigrain atta. Usual food, you can add millets. And so this will help him. Regarding proteins, this is also important aspect. So why is enough protein matter for weight loss? Because there are multiple benefits of eating protein, because it improves the body composition, it reduces the energy intake, it metabolically beneficial, it leads to better appetite control. And you have to spread your protein throughout the diet. For example, in morning, afternoon, so you don't have to give your protein only in the morning. You have to spread your protein. So most of us are not eating enough protein. If you calculate your protein content, you will know that you are eating less than 20%, which is recommended. You are eating much less, about 10%. And two ways to calculate the protein requirement. Either you eat protein 1 to 1.5 kg of body weight. So if you're 70 kg, at least eat at least 100 grams of protein. The other way to calculate protein is 20% of your caloric intake. So if you're eating 1800 calories food, at least 360 calories should come from protein. And what is the role of intermittent fasting, which is a new dietary management strategy? Does it help in obesity treatment? So there are many types of intermittent fasting, like 16-8. That means you remain fasting for 16 hours, eat only on 8 hours window. Then there are weekly fasting. For example, you fast for 2 days in a week, and then you eat for 5 days. So there are many types of fasting habits which you can employ. And there have been studies which have compared traditional dieting, that means they have reduced calorie content throughout the time, and with intermittent fasting, and what they have found that the results are same. So whether you do intermittent fasting or whether you do continuous calorie restriction, that means reduce your calorie intake daily, the weight loss would be same. And there have been many meta-analysis on patients with obesity and intermittent fasting, and they have said that as compared to daily calorie restriction, intermittent fasting achieves the same result. So Compared to traditional calorie restricted diet, intermittent fasting is neither superior nor inferior. So you can advise your patients to choose if he wants, if he is able to reduce his calories intake daily, he can choose this one, or if he is able to do intermittent fasting, he can choose that. And whichever dietary method you follow, but adherence is the most important thing. What about exercise? So we have to increase his NEAT. So what is NEAT? NEAT is non-exercise activity thermogenesis. So basically instead of going through this hi-fi terminology, you have to advise the patient to increase his daily physical activity. Whether you do your household chores, whether you walk instead of taking a vehicle, whether you climb stairs. So you have to apply this in your daily habit. And so out of the total energy expenditure, physical activity in a sedentary individual is much less. But if he is an active individual, he is doing much of his household work or activities is more, then his NEAT is actually leading to much more calorie loss. And it has been shown that people who are like farmers or home workers, if they are more physically active, they are able to burn their calories much more. So increasing your physical activity helps in achieving weight loss goal. So NEAT is an important form of calorie burning than doing exercise. So encourage your patients to be more physically active in various forms of day-to-day activities. And one simple thing is increase your step count daily. At least try to increase to 8,000 to 10,000. And which exercise is better for weight loss? There are many types of exercise, but exercise alone will not lead to weight loss. So you will have to associate with the calorie restriction and diet. So along with calorie restriction and diet, if you use exercise, then you have to combine resistance exercise with aerobic training. Then you will have much more weight control. And what is the role of yoga? So there have been studies which have compared yoga with no exercise. So if you're not doing exercise, and if you compare with those who are doing yoga, although there is no reduction in weight, but at least you will reduce your waist circumference. And yoga as compared to other exercises, there's hardly any difference. So it is same. So exercise alone will not reduce weight. It has to be combined with dietary modification, and a combination of aerobic and resistance exercise is better than either alone. And yoga is not very effective in reducing weight, but is able to reduce your waist circumference. So what does not work? That is also important. Crash diets don't work. Meal replacement shake which are available, these don't work. Apple cider vinegar and lots of other things which are mentioned in the internet, green tea, they do not help in weight reduction. So to summarize, set a goal of healthy lifestyle and not merely weight loss. Be mindful of what you're eating. At least be conscious what food contains high calorie and what food contains low calorie. Choose a low glycemic index food and with food which has got high protein content. Physical activity is much more than actually going to the gym. And adherence is the most important thing than choosing any particular type of diet or lifestyle. Thank you for your patience.